Hi, my name's Laura Mistretta, and this is my midterm video journal for Intro to Case Management with Professor Lisa Dubbert at the Community College of Vermont. So I want to start off by talking about what is case management. The textbook we've been reading this semester defines case management in two ways at the first chapter. First, case management is a method for determining an individualized service plan for each person and monitoring that plan to be sure it is effective. And second, it is a process used to ensure that the money being spent for the person's services is being spent wisely and in the most efficient manner. But what case management really looks like, there are four main tasks that a case manager is always working through: assessment, planning, linking, and monitoring. Assessment is at the beginning of a relationship with a client. The idea is to get a sense for the baseline of where the client is and where they're trying to go and what the barriers are for that, and also what the strengths of the client are. So an assessment can include a personal history, medical history, work history, a lot of information about the nature of the problem, how that problem is interfering with the client's well-being, and what needs are being left unattended to due to this problem or because of other things in the client's life or community. It also includes observations about the client's personality, mental state, and recommendations for how to address those barriers and move the client towards their goal. So after the assessment comes planning, and that is done with the client, which is great. It's really demonstrating the importance of self-determination in case management, which I really appreciate. It is the client's life at stake here, and it is up to the client to make the decisions with guidance from the case manager to let them know what the potential outcomes might be, the challenges, the benefits, but ultimately the client is the one that decides how to move forward in this part of their life. So after a plan, which should address all barriers and build on all strengths, it's the case manager's role to link the client with other resources, whether those are informal resources such as their neighbors or churches or other kind of community groups in the area, all the way up to formal other agencies who may be able to provide different types of services or resources for the client. And in that process, the case manager's job is to advocate for the client's well-being and make sure that they're getting the best services and the services that they really need. And lastly, the case manager's role is to monitor. So that means coordinating with all the services, tracking the progress of the client with the various services they're accessing, and making sure that they're effective in meeting the client's goals. So that's a really broad job. And when I think about case management, it's really helpful for me to think about it in the context of the work that I'm doing and the work that happens in my office with housing. In the affordable housing world, people often refer to the three-legged stool. That affordable housing really is made up of three key components, and without any of them, the stool will fall over. Those three components are actual housing units, subsidies to bring down the cost of that housing to make them accessible to people with lower incomes, and services. And for some folks with higher barriers, they require case management to really access those services and to stay on track with all the various services and topics that they would need support on to maintain their housing. And I think this is a really excellent example of the two main definitions given by the textbook regarding case management, because no two clients are going to be the same in the types of support and resources that will most help them, because everyone is individual with an individual context and history and strengths. And it's the case manager's role to figure that out with the client and make sure that the services being provided fit them. But also, it is a demonstration of how the case manager's role makes sure resources are being used efficiently, because there are cases where people without case managers are at high risk of losing their housing and ending up back on the street or back in the emergency room or incarcerated, which costs society way more money than figuring out a way to maintain that person in housing. So generally speaking, I think, and I've heard from my coworkers, that there is a real need for more case managers and to make it easier for folks to access case management so that they can be successful in their lives, and that we can make sure the resources we're providing as a society are able to be accessed and used successfully by people. So what are some successful elements for a case manager in order to work with clients? Well, I think it's really clear from the reading that one of the most critical skills for a case manager to have is to be a good listener, to use reflective listening techniques, to really make sure that the client is in the driver's seat in these conversations, and that it is the client is the one who knows most about their situation. So it's the case manager's job to make the client feel comfortable, to be able to express and let them know everything that's involved in their situation. That also involves maintaining, and practicing non-judgment and patience, cultural competence, making sure that we are not bringing, outside beliefs to our client's situation, and really seeing our clients as individuals and respecting their experience and viewing that experience with empathy, meaning viewing their situation from their shoes without taking it on as our own problem. The client is the one coming to the case manager with a problem, and it's important to maintain that boundary and that understanding so that you can best serve the client and keep a level head about the situation, because it's probably pretty stressful, and the client's already stressed, so the case manager plays a role to be a kind of balancing force here. Lastly, I think some great things required for a case manager, don't take things personally. Again, that's and respect that individual's experience. Encourage the client, build on their strengths, and be their cheerleader as they're working through sometimes a very complicated or hard process to change. And build good relationships with colleagues, because no one case manager can or should be doing everything for their client. I mean, the client is the one who needs to do the work with the support of many agencies potentially, and it's the case manager's job to help build those connections and facilitate those connections. So I think what excites me most about case management is that it really seems to be built on a foundation of treating others with dignity, empowering people to make decisions about their lives, and providing them with the skills and connections they need to be successful so they can be back in the driver's seat in their life and have their entire well-being met. I think a really radical piece about case management that attracts me a lot is that it really believes in the people's ability to succeed and change, with an understanding that change may take a long time, it may be a lifelong process, and that can only happen at the rate the client is able and willing to change, but that is still a incredibly important and worthwhile to work towards that change. Professionally, already the skills I'm learning in this class have been really helpful in my current role at the mobile home program. This class has definitely intrigued me to bring more case management skills to my interactions with clients. And I could see myself in 2 years actually being a case manager, getting experience more directly with this work, and also potentially working towards my MSW. Because in 5 years, I would like to be fairly established in my community and in my profession, working more on the level of helping to identify key intervention points, really taking kind of a larger look at the system and how we make sure it's meeting people where they're at, and that we're not letting anyone fall through the cracks. So whether that means, a social worker at a hospital who trains pediatricians to screen the mothers of their patients for domestic violence, I mean, that's a really, key intervention point. So kind of work like that to make sure everyone has the opportunity for this sort of work with a case manager. And then in 10 years, I could see myself running for public office. I've given it some thought in the past, but I think it'd be really valuable. I've got experience in political organizing and human services, and the perspective case management provides around the really human-centered, dignified perspective on each other is something that feels really lacking in our overall system, and I think we need more elected officials who understand that and are really taking a critical eye at all our policies and plans to make sure that these are human policies, that we can be helping improve everyone's life in the society. But in the short term, definitely have some questions about how to get to where I potentially see myself going. My two main questions: first, I'm curious about what population I'm really most drawn to work with. Right now, I mostly work with seniors, mostly due to just the demographics of Vermont's mobile home parks, and that's been great. I enjoy it, and it's been working really well. But I am curious about what it's like to work with young people or other populations and figure out how to get more experience, more diverse experience in the human services field. And then second, I guess my question is, it seems like there's a lot of case managers right now in the human services field that have very specific focuses, and I can see the need for that. For example, we have housing case managers here in the office, and then people will also have, a case manager for their medical needs and a case manager for, other parts of their life. And I guess I just wonder about, whether the specificity of that is always helpful, and what it would take to provide a more general case management roles for people to make sure there really is a central figure coordinating all of this instead of multiple people, just taking slices of people's lives. Though again, no case manager can do this all alone, so it always takes coordination. I guess I'm just curious about how that really plays out in practice. So that's my video journal, and I look forward to engaging with people in the comments. Thanks.